So I'd like to give an update on lung cancer, so presentations from this year's ASCO. So it was probably not the best year for lung cancer, but we have nevertheless seen interesting results, and it was probably somehow a consolidation of what we have seen during the last years. If I start with immunotherapy in patients with lung cancer, then I would focus on, first of all, I would like to focus on the long-term outcome of the KEYNOTE-001 study. So the KEYNOTE-001 study was initially designed as a phase 1 study, and then with a lot of expansion cohorts. And in the expansion cohort for lung cancer, patients with non-small cell lung cancer, irrespective of PD-Ligand-1 expression, were included. Also patients irrespective of previous lines of therapy. So we have patients in first line, second line, and also later line. And what we see in the long-term outcome in this report from this year's ASCO, we have now 5-year overall survival results. And what we see is that in a subgroup of patients with PD-Ligand-1 positive tumors or highly positive tumors with a cutoff of 50%, and mainly in patients treated with pembrolizumab as a first-line therapy, then we see an overall survival after 5 years of 25%. So this is really astonishing to see long-term survivals in patients with metastatic non-small cell lung cancer, and also in other cohorts, although they perform poorer, but also in patients that received checkpoint inhibitors or pembrolizumab later on, and also in patients with not a high PD-Ligand-1 expression, we still see an overall survival in the whole population after 5 years of approximately 15%. So this is certainly of high interest. We also have seen an overall survival update from the KEYNOTE 189 study, so the first-line study showing a superiority of the combination of platinum-based chemotherapy with pembrolizumab in adenocarcinoma. And again, it clearly shows that with the combination we have a superior outcome compared to chemo alone. So this again confirms the important role of checkpoint inhibitors in patients with non-small cell lung cancer. We also have seen some results for neoadjuvant trials, so in the curative setting, 2 small studies, but both of them clearly confirming what we have seen earlier on, that first of all, it is feasible to use checkpoint inhibitors in a neoadjuvant setting, so before surgery, and again, quite high response rates, quite high rates of pathological complete remission in the surgical specimen. So in the next few years, we will see more results for the curative neoadjuvant setting. Would also like to refer to our own study within the SAKK network, where we hope to have our first results from 1614 in the next year. Then we have seen many presentations on molecularly defined subgroups. So we have seen new inhibitors for MET-positive patients, so mainly for patients harboring a MET exon 14 mutation. So 2 new drugs results from 2 new drugs have been presented. So that's first of all capmatinib. And the second drug for MET-positive or MET-mutated patients is tepotinib, also showing really interesting results with high response rates, as we have seen it for other molecularly defined subgroups. Then also another molecularly characterized subgroup are the RET-positive patients. We have already seen some retrospective analysis for unspecific RET inhibitors, and now at this year's ASCO we have seen results for a very specific RET targeting agent, so the blue 667, and also this drug seems to be highly effective in this small molecularly characterized subpopulation. Another subgroup of patients are patients with a HER2 exon 20 insertion mutation, and this so far has been a very difficult to treat population because it is a highly aggressive disease, and the conventional EGFR/HER inhibitors haven't shown activity or only small activity in this subpopulation. So we have seen last year first results for poziotinib, a very specific inhibitor of HER2 and EGFR exon 20, and this year we have seen results for another new inhibitor, again with really interesting results. So to conclude, we can say that we have, for molecularly characterized patients, we have seen interesting results for new drugs, more specific drugs with overall quite a good tolerability as well. And on the other hand side, we have seen confirming data for the important role of checkpoint inhibitors in patients with non-small cell lung cancer.